Ladies and gents, greetings to each and every one of you. I am Ebenezer Smith from Chem 112, and I am going to be presenting on how can people best prepare their bodies to fight a COVID-19 infection. It wouldn't hurt to hear what you've heard before, and it wouldn't cost much to listen to this if any of this is new to you. So some bit of introduction. On December 31st, 2019, the World Health Organization, which is WHO, announced the outbreak of the coronavirus disease COVID-19, which was first reported from Wuhan, China. This was pretty much new to everybody and I was shocked. So the COVID-19, which is severe acute respiratory 2 COVID, has spread to almost every continent and country on planet Earth and has caused severe public health burden. Even till now, we are still facing it. So let's look at some symptoms of coronavirus. First and foremost, some people can have coronavirus and still wouldn't show any symptoms. Call those people asymptomatic. But the usual signs that anybody who is suffering from coronavirus is going to show. It's going to be some dry cough, some tiredness, some fever, or a temperature 101 upwards, and then you're gonna have some pneumonia, some sore throat, some shortness of breath, some muscle pain. After all, the best way to confirm if you have the virus producing a COVID-19 disease is with a laboratory test. So you can have a fever, you can have some of these symptoms, and it really might not relate to COVID-19. So the best way is to go for a laboratory test. How can people prevent themselves? So some kind of preventive measures. These are some of the ways to safeguard yourself against the disease. First, hand washing, often and thoroughly with soap and running water for 30 seconds or longer. And if soap and water is not available, you're going to use some alcohol-based hand sanitizer. So for the use of alcohol-based hand sanitizer, I happen to work in a hospital, so I pretty much know a bit details of some of these protocols. So if you are to rub your hands with alcohol-based hand sanitizer, if you do it 3 times, you're gonna have to wash your hands. Because as you keep rubbing it, as you keep adding the alcohol-based hand sanitizer and rubbing it, the dirt happens to be piling up in your hands. The more you do it, and that's why it's recommended when you wash your hands after 3 times of using alcohol-based sanitizer. Else, the more you do, wouldn't provide any kind of protection for you as it's supposed to be. The second thing is going to be to follow appropriate coughing etiquette. If you have a cough or respiratory syndrome, so you cover your hands. You cover your mouth with a napkin if you are coughing, and when you are done, you're supposed to throw the napkin away. If there's no napkin, you're going to have to cover your mouth and nose with the sleeve of your shirt any moment you are coughing. And then you're not supposed to touch your nose, your eyes, and your mouth with your hands. The reason being that if your hands have been contaminated, if your hands has been infected, if it's dirty, if you touch a place which is infected with any of these viruses, you're going to be taking it into your mouth, you're going to be taking it into your nose, you're going to be taking it into your eyes as you touch them. So you're not supposed to touch them. The fourth thing is going to be wear a mask when visiting medical facilities. You want to protect yourself and other people there, so you have to put on a mask. You do not visit crowded places. You do not come close with people who have symptoms such as fever or cough. And then the very thing which is recommendable at this very stage is vaccination, whether it is Moderna, whether it's Pfizer, whether it's AstraZeneca, whether it's Johnson & Johnson. You need to get vaccinated. And then there are going to be some kind of critics out there that the vaccination is not good and stuff like that, but for our safety and for the safety of your family, for the safety of everybody, it took scientists a lot of years, a lot of time to go in for this vaccines. So why would they try to kill you? If it's something to kill, why would everybody in the top positions taking it? The president and his fellow members, why are they all taking it? So it is better we boycott the kind of accusations and criticism that the people are based on these, and then we can go for the vaccination. Now let's look at some use of vitamin C in the fighting of this whole coronavirus thing. So as acute respiratory distress syndrome is a key factor of fatality. I mean, it significantly increases oxidative stress due to rapid release of free radicals and cytokines into the hallmark of ARDS, which leads to cellular injury, organ failure, and death. So early use of large dose antioxidants such as vitamin C may become an effective treatment for these patients. So in a report of 29 patients with COVID-19 pneumonia, 27, which is 93% of them, showed increased hs-CRP, a marker of inflammation and oxidative stress. The transcription factor, nuclear factor erythroid 2, which is NFE2 related factor 2, and RF2 is a major regulation of antioxidant response element ARE, which is driven cytoprotective protein expression. Continuing. So activation of NRF2 signaling plays an essential role in preventing cells from injury induced by oxidative stress. So vitamin C, an important component of the cellular antioxidant, is beneficial to critical care management. So since the prevention and management of antioxidant stress could be realized by a large dose of antioxidants, this approach may be applicable to COVID-19 with intravenous high dose of vitamin C based on the outcome of 3 poisonous critical studies involving a total of 146 patients with sepsis. And let's talk a bit about some new variants of coronavirus in assistance of some kind of warning we're supposed to take. So March 18, 2021, the CNN reported a heated conversation between the Republican Senator Ron Paul and Dr. Fauci, the director of the U.S. National Institute of Allergy and Infectious Disease and the chief medical advisor to the hospital. So Dr. Fauci in this conveyed that there have been new strains of coronavirus in the system, of which he mentioned the dominance of 117, which is originally from UK, the variant 526, which was found in New York, and the 427 and the 429 in California. So being vaccinated gives you a certain level of antibody that is specific for a particular variant strain. So the Moderna, the Pfizer, we are having the vaccination we're taking right now. It gives you some kind of protection against some strain, not all strain. So you can be vaccinated and still be infected with these new strains. So let's be safe out there. So we're excited. Took a couple of stuff from the Journal of Educational Evaluation for Health Professions. I took something from the Critical Care website, and I took something from CNN on YouTube. Thanks to everybody for listening, and let's be safe out there. Thank you.